Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical therapist.
and together we are the most famous physical therapists on the internet.
In our opinion, of course.
Yes. Brad, what is your relationship with your bed?
It's very close, Bob, especially at night.
I actually get along with my bed quite well.
Yeah.
It's my alarm clock I don't get along with. But I'm bummed. Anyway, unfortunately for some, pain, the bed can be the source of pain.
Oh, yeah,
So
sure.
we're going to have some videos here describing how to avoid those pain scenarios. All right, so the subject of this particular video, Brad, is going to be on shoulder pain, how your bed can contribute to shoulder
Sure.
pain. I think it could even cause pain if you, lay in the wrong position for a long enough
Sure.
time over a number
Poor
of years.
habits, yep.
Right. So could we have our pillows again? Nancy, get to work here. Ooh,
Here she goes.
here you go.
Oh,
Oops, I almost did break his glasses.
okay, let's get to work.
All right, Brad, let's, first thing you want to do, let's talk about laying on, let's say you have a sore shoulder already.
Sure.
One thing, this sounds obvious, but I have so many patients that still do this because it's a habit, they'll lay on that shoulder.
Yep. I
And you
have
just
the same
can't do that,
experience.
so, Brad, if you want to get it out of the way here. All right, sorry, I don't want to upstage you here, but you want to put another pillow
Oh,
there? Because if I'm laying on my side, I want to
Yeah,
have two pillows.
two pillows, keep that head.
But if I'm laying right on the point of the shoulder all night long, there's not great blood flow to there,
Right.
and especially if you have tendonitis or bursitis.
Sure.
Yeah, it's gonna hurt me, so it's just common sense, and a lot of times the pain won't let you do it. But if it does, don't lay on it, let it heal.
Right.
So one solution would be to kind of just roll over onto your back slightly, onto the shoulder blade more.
Yeah.
And you could even put a pillow behind you if that helps keep you in
Yeah.
place.
I think sometimes when you don't want to be
Actually,
rolling
does look
around and you position pillows around you, it'll help you, because you might fall asleep like this, but then an hour later while you're sleeping,
Right, you roll right back
without
onto it
knowing
again.
it, and then you wake up with a sore shoulder, and it really wasn't your fault.
That's why this pillow here really does help.
And you could also put a pillow here and
Sure, yeah.
barricade yourself, so to speak. One of those body pillows, those big long body pillows, I
Yeah,
bought
I think
patients
that's
if they have them, use those to their advantage.
And they kind of hug them and stuff.
Right.
So,
Yep.
Brad, why don't you show what you do if you are laying on your back? How would you put your shoulder? Or do you want me to show it?
Oh, no, yeah.
Was I confusing you?
Alright, I'm just kidding, Bob.
This is the bad shoulder.
Okay. Actually, my right one's bad right now, but we'll get to that later. Okay, so if you're like
The
this,
problem with this is now your shoulder is at what we call nearly end range somewhat. I mean, it's even hyper, it's not end range, but it's, you know what I mean? It's coming forward a little bit.
anterior.
Anterior, yep.
Alright,
So what you'd want to do
Yeah.
is, this is one that I have people do all the time. Even when people have a bad shoulder, when they're sitting, I have them support the arm like this, just to give it
Yeah.
some support.
I actually like it up here.
Yeah.
But another thing about this is it will prevent you, and when you're sleeping, likely not to do this.
Sure.
And end up on it. So it supports it while you're in supine as well as reducing the risk of rolling on it.
The other thing, Brad, is if you're laying, again, let's go to your bad shoulder. Let's say this is the bad shoulder, and
Sure.
you lay on this side again.
Yep.
Okay, again, you can put two pillows out here to support it, right? Two
Yeah.
pillows, or one like
Or
that.
I would probably take another one. Because this is kind of dependent on the patient too, isn't it, Bob?
Right.
I mean, you tell them what to do and
They have to experiment.
Yeah.
But the other thing, a lot of things that people will do if they don't have the pillows is they'll go like this.
Yeah.
And that's fine too, that puts it in a decent position. What's the thing you want to avoid, Brad? You don't want to sleep with your arms over your head, right? And
Yeah.
I'm guilty of this. Yeah, just go ahead, Brad. Oh, no, you don't want one.
No, I just want one pillow. That's two pillows.
Okay.
There. If you fall asleep like this.
I actually fall asleep with my right arm on it like that, believe it or not. And the other way you'd be doing it, Brad, is if you don't squish your glasses, but if you lay it on your stomach.
Oh, yeah.
This one I think is more common, what you say. And this is what causes a lot of people's hands to go to sleep.
Yeah, if I do this one, we talked about this on the video, but if I don't do this anymore because it really bothers my shoulders before I fall asleep, but if I fall asleep like this and I wake up, my arms would be so numb, I couldn't move them or feel them. I remember once, I bit my arm, I still could not feel. I bit it,
Wow.
and I had to go over like this, and my arm plopped. And then the circulation started coming back, and it was tingling, and within a couple minutes, it went back to normal. It was really fun, actually. I wouldn't do it anymore, because it's not good for
Well,
you.
the thing that happened to me one time is my arms both fell asleep and my alarm went off, so I'm going like this, trying to get the alarm to go.
You should have got it with your nose.
Are you implying something, Brett, about my nose?
No, I was just saying functionally, you could have got it with your nose.
Anyway, by the way, we have a trivia question on this one.
Oh, yeah.
Because the other thing the bed can do for you is it can give you bed head. So we're gonna put up a picture here, and this is a picture of a star you should know. And Nancy, got it up? Okay, she doesn't even know who it's gonna be, but I'll tell her afterwards. Now this star, I want you just to give the name of this star and look at his hair here. For some reason he thought it was a fashion statement, but it actually looked like bed head to me. How'd you sleep last night, Brad?
Oh, Bob, I woke up and it's my hair. I can't
Yeah,
do a
same
thing
with
with
me,
it.
same with me,
This
I
is
guess.
bedhead,
This
huh?
is bedhead, the bed strikes back sometimes, which reminds me, by the way, if you are 50 and older and you still have hair, you want to subscribe to us, no, even if you don't have hair, because we provide videos on how to stay healthy and fit well into your 80s, 90s, 60s, 70s, 80s, 90s.
You better believe it.
And also how to avoid pain. And believe it or not, we do have some dignity.